Welcome back to Melisia Talks, where we talk all things uniquely you. For the month of May, you are tuning into Medical Moments with Dr. Melisia Robinson, of course. And as you all know, I am a nurse practitioner with my doctorate, and that is a doctorate of nursing practice. And so, last week's episode, if you did not tune in, be sure to listen to it. And if you did, thank you and welcome back to week number 2. But we did look at the overall scope of practice for nurse practitioners and what your nurse practitioner can do for you, specifically in my certification, and that was the adult gerontology primary care nurse practitioner role, and that overall aspect of primary care when it comes to the nurse practitioner. So please take a moment to listen to that. And why am I doing this? Because it is Nurses Month, and we are celebrating Nurses Month, and specifically for the week of May 6th through the 12th, but we also celebrate it for the entire month. So I want you all to thank and give some love to your nurses, your nurse practitioner, if you have family members, if you are one. Happy Nurses Month. All right. So be sure to celebrate them and love on them. All right. So for this week, I did say that I wanted to look at a few different things as it relates to one topic that you don't really hear a lot about unless you are one of those people who are in the community, really have an ear to, health equity or even just disparities and, various social determinants of health is what we call it. And that's just pretty much looking at, what socially can affect our clients or people in general. The environment, right? Housing, if they live in a place that's considered a food desert where they do not have the resources for nutritional foods or nutritious foods. And so I wanted to dive a little bit deeper into that because currently, although I practice as a nurse practitioner, per diem. Overall, I teach and I am in the educational sphere of nursing. And so, one of my classes that I teach and I absolutely love is community health. And so, I really wanted to bring some clarity and shed some light on, what that is as it relates to social determinants of health. And so, when we talk about that, I want to first look at what we look at as health equity. And so when we talk about health equity, we are looking at the fact that everyone should have a fair opportunity to achieve their fullest health potential. And no one is disadvantaged because of a social issue, an economic issue, or an environmental issue. And so overall, we're looking to eliminate those various barriers that can lead to those various disparities that we see so often. And so some differences could be, in access, whether it's access to healthcare, access to, various populations, especially in diverse populations. And so overall, just looking at that and how we can be the motivating change agent or motivating factor to help bring about some sort of change in this area. And so if you're not one of those people who have the opportunity to, learn these things, be a part of these different things, I really challenge you after listening to this episode to kind of see, if you don't live in an area that is considered challenged or have disparities, think about those other persons that do. If you are, I know, probably busy, have other things going on in your life, and we see people all of the time that are, maybe homeless or, are less than, as we would say, think about them. Do some research. If you aren't one who goes out to volunteer, do that and see what differences you can make in those various communities that are outside of where you are. And so I really challenge you to do that. All right. So I mentioned already, what those social determinants of health can be like. And I've also mentioned, overall what we're trying to accomplish, and that is health equity for everybody. But how can we see disparities in various areas? So it could be, as we know, racial and ethnic disparities. And we do realize that there are structural racism or is structural racism out there. We cannot deny it, right? So this unfortunately can result in unequal access, biased treatment. We do hear now, unfortunately, when it comes to African American women and maternal health, that maternal factor is unfortunately lower as it relates to the proper care that we should receive. And again, that is considered one disparity. And so mistrust in the healthcare systems. And we know that dates back to, unfortunately, many different studies that we've heard of, such as the study with Henrietta Lacks and also the Tuskegee experiment, excuse me. That, of course, was something that we have heard about and really set an unfortunate precedence and tone for mistrust in the healthcare system from minority groups. And so overall, that is one health disparity that we have. And so another one could be the geographical locations. We know that rural areas that we have surrounding our major cities can be an area that does not have the proper healthcare facilities. They may not have specialized providers to be able to provide the specialized care that is necessary for whatever treatment or issue that they might have. Also, reliable transportation. Many people do not have the ability or can afford to have a running vehicle. And if they don't have that or cannot, utilize public transportation in a rural area because it may not be, provided there, this unfortunately leads to another barrier for those persons geographically. Another huge one that we see all of the time is language and cultural barriers and miscommunication, the lack of cultural competency as it relates to care. This can be a huge barrier, and it can lead to, those persons not getting the proper care that they need, the proper treatment that they need, all because they could not understand the language. And so a provider can have various biases that can lead to, misunderstandings and even less effective treatment plans for that person. And so it's so key. And we're always trying to educate, our students and those new nurses as to how they can find ways to communicate with those persons who do not speak the language. And so we always say whether that be by way of printing out various documents in that client's language, or first and foremost, getting an interpreter that can look to help this client understand the information. And so that is one of our main unfortunate barriers that we see, and that is, again, language. Another one could be, just having a disability or chronic illness. And so we know that those persons with disabilities or these various chronic conditions, it could be respiratory issues such as COPD. It could be, of course, hypertension. It could be chronic kidney failure or disease. Oftentimes they encounter challenges, in just accessing the various facilities to be able to help them with this disorder or even receiving that specialized care because many times they can't afford it, right? And so just understanding how those various things can lead to unfortunate social determinants of health that are unequitable. And so really keeping that in mind with those various potential ways. And so again, I mentioned the, racial and ethnic disparities, geographical, also language and cultural barriers, and even the issues of potential chronic illnesses. And so overall, how can the nurse practitioner, and that is what I'm loving to pull out here when it comes to these episodes over the next few weeks. And so that nurse practitioner, we are in that very unique role and position to be able to address these, due to, their overall patient-centered approach. We give, as I said last week, that holistic, aspect of care to our clients that many physicians, don't usually do. And so we are the ones who are emphasizing that and taking that approach, and patients really enjoy that and they love it. And so we can be that advocate for that client, making sure that we are advocating for various policies and programs that can address specific social determinants of health and issues, such as, again, the affordable housing initiatives, expanding public health, funding. Even though we are not always the city council person, we can still go lobby. We can go and advocate and on behalf of our clients, right? And so there are some nurses that, I truly champion and am happy to hear that they have taken the step to become one of those congresspersons or city council persons to be able to help in these areas. Some other ways that we as nurse practitioners can assist our clients is through education and counseling. So overall, educating our patients about how to manage their conditions and how to navigate the healthcare system. I cannot stress enough, in this area of healthcare, there is so much. And many of our elderly clients or people who just don't understand and how to navigate it, they can get lost. And so, us being there to be able to help navigate and show them the right path or lead them to the right provider or lead them to the right information can help empower that population that is more underserved. And so that is one thing that we can look to do as nurse practitioners. Also looking at community engagement, participating in various outreach programs or free clinics. Overall, this helps to build that trust in that community and overall making sure that, we are there with boots on the ground. I mentioned that term last week, but really being there and helping them to see that, hey, we care for you. We are here for you. We are here to, allow for you to get the services and the, of course, support that you need throughout this time frame. And so I mentioned already that culturally competent care. So again, just understanding that client's background. If you are going into a certain community, and we know here, where in various cities, I'll just say that we have more of one ethnic group on one side of a city than another. So, overall learning about that client's cultural background and their various beliefs is going to be key because that helps to ensure that their treatment plan is respectful and effective of, whatever it is that we are trying to treat them, with and so forth. And so making sure overall that you learn about that client's background, right? Learn about their beliefs and values. And so that helps you again to make an effective treatment plan for them. And then also being mindful of screening and prevention. I mentioned already previously in an episode how there are various screening tools out there, screening routines, as it relates to if your client is at risk genetically for hypertension or for chronic kidney disease, or if they're at risk for, cardiovascular diseases and even coronary artery disease, those things. What can we do as it relates to various screenings to be able to help with that, right? And so mental health, how can we screen for that? We know that there are different screening tools out there for that, for depression. There's also some out for anxiety. And so what are some of those things that we can look to assist those clients with and look to identify those risks early, right? Risk factors we always hear, and how we can look to guide them with proper interventions to be able to prevent those things from happening. Now, we've talked about some of those main things that look to unfortunately drive health disparities. And we've also looked at the role of the nurse practitioner, in addressing those. But then now let's look at some practical ways that we can look to actually get this to the client. I mentioned already, whether that's holding an actual outreach program, but also thinking about if that client can't come to us, what's some other ways to access them? Telehealth. We know that that is huge right now. So telemedicine services, mobile clinics, and I know wherever you are, you've probably seen a mobile clinic of some sort. I know there are, mobile clinics for HIV testing, mobile clinics for breast cancer screenings, for mammograms. There are so many different things that can be, seen to be able to help our clients if they can't reach us. We go to them. So telemedicine and mobile clinics are key. Also, collaborating with other sectors, whether that's partnering with schools, because we know it's just not for adults, but also for children who could experience unfortunate barriers and issues if they're a part of these disparities, right? And so, being mindful of the various social services that we can collaborate with, community organizations that can help improve our network, right? And support these clients throughout this process. And then we can think about the ongoing monitoring, that data that we can receive from whether it's the wherever you live. I live in Florida, the Florida Department of Health, even the Department of Health in the city that you live in, or even nationally, the CDC, Center for Disease Control, and how that looks overall to as relates to each individual state and also in individual city. There are things there as well. So monitoring those disparities through various ways. And even if you're on the local level, maybe the electronic health records that you have access to, community health assessments can be also done. And so those are just some ways that we can actually address it head on. Again, access is a big one. Also collaborating with others, and then being mindful of that monitoring of various disparities and how you can utilize that data to make a difference. And lastly, here, what are some of those things that are continual challenges for our patients and even sometimes for providers? And the main one is insurance limitations. Just thinking about that, some people don't have insurance to be able to get the proper care that they need. And even if those persons may have insurance, the high out of pocket costs at times can make that person not even want to access care in a timely fashion. And so we have to keep in mind that there are continual unfortunate challenges and trends that are out there. And this is a main one, a really big one. And again, that is insurance limitations. Another one, when we talk about diversity and, looking at racial and ethnic disparities, it's the lack of diversity among, healthcare professionals, and so if you don't see someone that looks like you, it can be hard sometimes to trust, as we said a moment ago. So if, of course, you're able to have someone that looks like you taking care of you, it helps to, decrease the mistrust, helps to decrease the biases that are unfortunately out there regarding racial and ethnic disparities. So that is another continual challenge that we are working on. And then also thinking about the political and economic factors. We know even now that we're hearing about it, and I hope that it does not happen, that funds are being taken from, those who are considered to be more vulnerable during this time frame in this season, as it relates to receiving health care and that equitable health care that, others may be able to receive. And so politically, if that is something that, happens to where it's defunded in those areas such as Medicaid and Medicare, that can be very unfortunate. So these are just, again, continual trends and challenges that we are facing in our society. The issue with insurance, as I mentioned, the lack of diversity, and also thinking about the political climate and how that can potentially deprioritize funding to those vulnerable populations that we mentioned already. So your nurse practitioner, overall, we, as I said last week, play a very vital role in looking to hopefully break these unfortunate cycles. And we can do that by continuously providing compassionate, equitable care, and also leading in the various conversations for, healthcare reform and reform of policies and various practices. And so I know this is probably not what you are used to hearing, but I really feel that the more that we're talking about, Nurses Month and Nurses Week, and from the nurse practitioner role, some of the things that many people don't really think about. And especially if you don't have a challenge right now, or a challenge or a health equity issue. So if you're one who don't have an issue, are you really thinking about those who might? Are you really thinking about those that might be experiencing these disparities? Are you thinking of ways that you can help? Or people that can help, and your nurse practitioners can do that. All right, so this is week number 2 of Medical Moments with Dr. Melisia for the month of May. Tune in next week for another episode that will, of course, challenge you and help you to understand overall your health and what your nurse practitioner can do. Until next time, bye.